Heard at Health is sponsored video content brought to you by MedCity News.
Hi, I'm here with Ellen from MediDrive. Thank you so much for being here, Ellen.
Oh, it's a real pleasure. Thank you for having me.
Yeah, of course. And maybe to get us started, Ellen, can you just share a little bit more about yourself and your work in healthcare?
Yeah, I'd love to. So actually, my journey started in 2002. So I've been in healthcare for a long time. I actually came across from the UK way back when, and I started at Empire Blue Cross Blue Shield. And after that, I went to United Healthcare. I actually started a health insurance company in 2013, just after kind of or just before the Affordable Care Act was coming in, which I don't actually recommend. And then I went back to Empire Blue Cross Blue Shield as the president and CEO in 2018. And Marissa, I left that role and started MediDrive, which we'll obviously get into a little more in 2023.
Great, very interesting. And going off of that, research shows that about 1 in 5 US adults forego medical care because of transportation barriers. This is driving a lot of growth in the non-emergency medical transportation space, and there seems to be many local and national NEMT providers out there. So what makes MediDrive unique in this space?
Yeah, it's a fascinating question. I would say the first thing that really has us stand out is the combination of our transportation experience and our healthcare experience. So MediDrive is actually a related company to an organization called CTG, stands for Corporate Transportation Group. And CTG has been in the transportation space for almost 45 years. Corporate transportation, paratransit, in actual fact, has one of the largest paratransit contracts in the country with the New York City MTA. And with my healthcare experience, Marissa, we decided to come together because we truly felt there was a huge opportunity in the NEMT space to vertically integrate transportation into the actual journey a member is on. And so our mission is that we're driven to improve the health and wellness of all Americans by compassionately transporting them on their road to better health. But in order to do that, we're going to rely on that incredible transportation knowledge, what actually motivates a transportation provider, but also on the experience that member has as they go through their healthcare journey. Pun intended, by the way. And so it's the combination of being able to bring together those assets, put them into an environment that is incredibly tech heavy because it's so complicated, and then delivering an incredibly reliable result so that the patient, the caregiver, the health plan, the loved ones are all involved in that journey as it progresses.
Yeah, very well said. And there are also many companies joining the NEMT space, as well as legacy companies that can be tethered to older systems and technologies. You've talked about how MediDrive is leading some of the industry change. So, what should payers and providers watch out for when choosing an NEMT partner?
Yeah, it's a great question, and you're right. There's at least two legacy companies that have a very large kind of stake within the NEMT business. That being said, I firmly believe that the technology that is needed right now is just beginning to emerge in terms of its capabilities. And so, an older legacy system that quite frankly, may have been tried and tested, but is not keeping up with the rapid advancements in the medical space. And we were obviously just at Health, Marissa, and what is happening in our industry, not just NEMT, but healthcare, is staggering. The pace of change and innovation, whether it's technical innovation, clinical, artificial intelligence, is staggering. And so the ability to invest in technology that actually improves the product that is being delivered so that appropriate outcomes are occurring, I think is what is really the difference. At MediDrive, what we've tried to do is think of our technology and application in a way that mimics the path that a patient goes through, right? So what is that path? Well, pretty much it starts with somebody making an appointment. right? Or they're going to dialysis, they're going to chemotherapy, whatever it may be. And so how from that very beginning do you integrate all of the different people that are involved in that so that they can trust that transportation is going to improve that journey? And if it's done right and the person is picked up on time, it's reliable, you communicate in their language of choice. The provider knows where the vehicle is, knows when somebody is being transported, knows when they're arriving. All of a sudden, you've actually made transportation a vital part of that care journey. And everyone within that vertical chain can understand how it happens. I mean, if you think about one of the key things that a health plan wants to know is when one of their patients is actually receiving care, right? The health plan has a large kind of array of data and facts on an individual, but oftentimes doesn't know when they're showing up for dialysis or they're showing up for treatment. If transportation is involved and people can actually see and rely on it, then you're now providing a great deal of insight to the health plan in order to be part of that care journey in a more direct way.
Yeah, absolutely. Very well said. Well, Alan, those are all the questions I have for you. Are there any final thoughts you'd like to share?
Yeah, I would just say, I think as I've said, transportation is incredibly important. We talk about social determinants of care, whether it's food as medicine, whether it's housing. Ultimately, you had mentioned earlier, 1 in 5 people miss their appointments because they can't get there. In the Medicaid space, it's a statutory benefit. In the Medicare Advantage space, it's a supplemental benefit. If we're going to have those benefits, then it's really important that NEMT companies or the choice of NEMT company understands how that benefit ultimately impacts the healthcare individual. If transportation is done right, you're not having as much ER spend, you're not having the readmissions. It can be up to $22 per member per month in costs when transportation is not done correctly. And so, from my perspective, we're incredibly passionate about improving the outcomes of a person because transportation has helped them on that journey, Marissa. So I just encourage everyone out there to really think about what the next generation of transportation is and how it actually integrates with care pathways in order to make sure people get the care they need when they need it.